And now it's my pleasure, live in Las Vegas, to welcome Jessica Grennan, president of Simple Majority.
Hi, Laura. Good to see you.
Good to see you too. So we're here in Las Vegas for a conference about how to get issues passed on the ballot, because when your state legislature and your governor aren't listening, that might be the only way to do it. So tell us more about what is a ballot initiative.
Sure. Thanks so much. And it's really appropriate we're doing this while we're at the Ballot Initiative Strategy Center conference in Vegas. You can see our beautiful view. So a ballot measure is when the citizens take it upon themselves to pass legislation on something that they think is important. This can be done in many different ways. Only 26 states have the citizens initiative process, and it can be done through collecting signatures. So if you've ever been outside of your supermarket and someone's like, do you want to protect abortion rights? You're helping put that issue in front of voters. And it can also be done through referrals, that the legislature, sometimes if they can't get the votes they need or a governor's signature, they can send it to the citizens to vote on yes or no on that issue too. So it's pretty important. It's a pretty important way to pass policy. I've run a few. I was thinking about this on the elevator up here, but I've done a few healthcare ballot measures. I've done end-of-life options in Colorado, which we won. I worked on medical debt in Arizona, also won. These are my winning ones. They're not all this good. And then abortion in Colorado this year. So really been, I feel like people are sometimes ahead of their elected officials, especially with healthcare issues, and especially because we're dealing with it day in, day out. So it can be a really good place to put up these issues. Medicaid expansion that's passed where it's up, pretty much everywhere where it's up, because people see the benefits of this.
Mm-hmm. Yeah, because most Americans believe that everyone should have health care, but our legislators and our governor haven't gotten there yet. So tell me more about the medical debt work you did in Arizona. What did it do, and how are Arizonans benefiting?
Thanks, Laura. So we ran a ballot measure in Arizona that increased how people could keep their property if they were getting into debt situations. And a huge chunk of people that are in bankruptcy in the U.S. is because of medical issues. It's really startling how many folks, most people are one illness away from losing everything. And so we passed a ballot measure to make sure that folks could protect more of their house, their car, their savings account, the personal affects in their house. And also we lowered the cap on how much you could charge interest rate on medical bills. So I think, protecting people's property, protecting people's life, it's really been important for that. And it also started the conversation. Laura, I think, you and I both have talked about our healthcare issues over the last few years. I was in significant medical debt while I was working on this ballot measure. I had to walk out of surgeries because anesthesiologists, like the insurance company, screwed up on the reporting form, and I wasn't sure if it was going to get covered. I would go home at night and see $30,000, $40,000 bills for one hospitalization. I had 7 surgeries in a 2-year period. It's terrifying. It really does mess with you beyond what it does in the big picture. I can attest, personally, I felt like I was losing my mind. I was so stressed. I was coming home and just like, what am I going to do with this? And I was really lucky. I had a workplace where I could be on the phone. Sometimes I was on the phone with my insurance company 200 times in a week. Mm-hmm. I was using both my work and personal phone to call to see if that would change my responses. A third of my friends are lawyers that would look over my materials and send certified scary letters and help me or tell me what not to pay. And I really thought I was in that process. It hampered me getting well. Mm-hmm. It also was really isolating. I felt like I did something wrong, that I was in this problem. So I think these ballot measures that talk about things like medical debt, or I know even in your state of Virginia, it's on the legislature right now, or it's waiting for a governor's signature. I think it's really important to, beyond fixing the problem, also letting folks who have medical issues know they're not alone. Mm-hmm. This is a real thing. This really happens to people, and it can destroy your life.
Mm-hmm. Yeah, when I was diagnosed with cancer and I had a hospitalization, I received a $100,000 medical bill. My insurance company refused to pay any of it. So while I'm going through my first chemotherapy, my second chemotherapy, my third chemotherapy, I'm going through the appeals process to try and figure out how to pay for all that, because $100,000 medical bill, nobody has that much money just sitting around waiting to pay for that. And thankfully, I was able to get it resolved. It took several months of appeals. I had to find the ER doctor, and I had to get them to amend, and it was a major ordeal. But I had the resources and the time to do that because I was at home recovering from chemotherapy or getting ready to go to chemotherapy. So I had the time, and thankfully I had the good insurance coverage through the Affordable Care Act that was separate from my job, because many people, they might have good insurance through their job, but once something happens to you, you can't keep that job and you're about to lose your insurance. So I mean, my story has a good ending, but there are so many people that can't make their way through that appeals process and wind up with these gigantic medical debts. And as you mentioned, Virginia, there is a bill right now to put some limits on medical debt. And our governor has to sign it by May 2nd, which is coming up. Either he's going to sign or veto it. So we'll know very soon whether that's going to happen in Virginia. And if it doesn't happen, then it'll be back to the drawing board next year to see what we can do in Virginia to protect people from medical debt. So talk a little bit more about how some states have a ballot initiative process and some don't.
Yeah, not every state does the initiative process. So, it tends to be a lot in Western states, where I'm from Montana, so that works out very well for me. And, the New England states, it's just how the state constitutions are constructed in different places means of how the citizens initiative process is used. There's 26 states, and I won't try to name them because I will forget a few of them. But, it's something that's worth looking at if that's of interest in your state. And there's some really great groups doing really important work around the ballot measures. We saw a bunch of abortion ballot measures last year. We have seen, we see a lot of social changes happening this way, but they're expensive and they're hard to run. And so I would really encourage folks, if you're interested in this, join up with some groups that are doing it, and also I'm just going to do a quick pitch. If you're in Virginia, please call the governor and ask him to sign that bill. It's really important that we are showing strength around there. And, if we can pass this in Virginia, that would just make a huge difference, especially for all the folks that are out of work there right now. Mm-hmm. I just think things like that really matter.
Right. And ballot initiatives are a way around a dysfunctional legislature. Like if your governor and your state legislature are not listening, the things that win are things that have majority support in your state, but yet your elected officials are not acting on them. So this is kind of a Band-Aid on a broken system, but it is a way in many states, as you mentioned, that there is a way for you as a citizen of your state to have your voice heard when your state elected officials are not listening. So, I mean, the ideal would be to fix the state legislature.
Well, we can get some other folks in there, but it's also, I really love ballot measures. I love thinking about them. And I've been playing around with this whole idea. Laura, I think I started talking to you at lunch today, but we're at a conference, so we knew half the room that showed up. But looking at ballot measures, that it really does change the power dynamic is so interesting. It's like you're putting the voters as almost your elected officials. You're having like a lobbying relationship with your voters. And I mean that with a lot of respect. Like, you build for many months and sometimes many years why this matters, and you show other reasons why this matters throughout the time. And I think that's really interesting with ballot measures. When I ran the Colorado End of Life Options Act in 2016, God, that was a while. We partially ran it as a ballot measure because the legislature was behind on it. Mm-hmm. This was an issue that we won with 65% of the vote. We won the county of Colorado Springs, which is the head of the Family Foundation. But this was an issue people supported. And people used to it's funny, on a lot of the ballot measures I've worked on, folks will come up to me kind of quietly, whisper to me at a coffee shop, be like, I'm with you too. Friends, parents, or folks that like know me through other ways than politics, they'll just whisper like, I'm with you. And I'll be like, so is everyone else. So is everyone else in here. And I think it's a chance for people to really like dig in and decide what's important. You mentioned your healthcare, so many of us, but if we have health issues, I remember sitting in the emergency room in a gown and socks, reading a magazine, and they're like, if you pay for this now, you get a 20% discount on your copay. And I'm like, here's my Amex. And it's wild. Like, it's wild when you have the resources.
Mm-hmm.
And I can't imagine how terrible it is not having it.
Right.
Like, and obviously I can do the 100,000, but it's broken. We can do so much better. There are ways to do so much better, and we need to.
And people are put at risk from our broken healthcare system because my first hospitalization, I had this $100,000 medical bill, which was then hanging over my head for months afterwards. My second hospitalization, after I went through chemotherapy, I spiked a fever. And when you have a fever after chemotherapy, you need to go immediately to the emergency room because you are possibly going to die, because with chemotherapy, you have no immune system and any kind of infection can kill you. So your instructions are, if you go over 103 degrees fever, immediately go to the emergency room. So I have this fever and I have to start Googling to figure out which emergency rooms take my insurance, because the last thing I want to do, I would like to not die, but I would also like to not have a second $100,000 unpaid medical bill. And thankfully, I was able to Google, I was able to figure out which emergency room would actually take my insurance and go there and get treated. But how many people don't make it that far because they are so afraid to use their insurance? Because what if their emergency need is not covered?
It happens all, like you hear ER docs and nurses and the front desk folks, it happens. So I think it happens way more than we even know, or people wait to get sicker, which ends up costing us or costing everyone way more money. But, that happens. And it's not, the folks are making actually a pretty reasonable calculus in terms of what do I do? Mm-hmm. When you look at what the average American savings account is, and it's like not just one bill that happens. I remember I have really severe endometriosis, which is a disease that affects, probably 5-6% of the overall population, as many people as diabetes. There's only 300 specialists in the country for it, which is another story we'll talk about. But I was prescribed some medicine for it. And I had been in pain. I was losing a ton of blood for like 6 months. Like, we didn't know what was wrong. At one point, I had my tumor marker test was really high, and I'm standing in a pharmacy, and they're like, the pharmacist is like, they're not covering this. I'm like, but they say I need it. And he's like, so I'm on the phone with my insurance company, and they're like, we're going to cover a different drug. And I'm like, the generic? They're like, generic, because that sounds basic. I'm like, what the hell are you covering? And it turned out it was a totally different drug. And my pharmacist, luckily, got to support your small town pharmacist, heard my conversation. He's like, give me the phone. And he's like, that is a different drug. That is not what her doctor. And then, but I was somewhere where I knew everyone there, and they grabbed my phone. But I could have really been prescribed the wrong drug that would have been, because the pharmacist was making that decision. The insurance company was making that decision. Like, some doctor I never met made a recommendation on that decision to save them money. Mm-hmm. And I just remember just crying in the produce aisle, being like, I'm never going to feel better. But it was a calculus. I couldn't afford the $2,300 a month drug for something they weren't sure was going to work even.
Right. And so we talked about how the brokenness of your state legislature may be a good reason for the ballot initiative process. The brokenness of our insurance industry is another reason. I did some work in Illinois where they passed the Healthcare Protection Act, which actually reined in some insurance company practices where they can't deny you for emergency mental health coverage, and they have to act, they get penalized if their directory of providers is inaccurate, if it tells you that people don't actually take your insurance, and they can't sell junk insurance. There's a whole bunch of insurance company abuse protections in this bill that passed in the Illinois state legislature and was signed by the Illinois governor. And I would love to see that on a federal level or in other states. And if your state legislature is not willing to do the work, these are extremely popular issues, because most Americans think that if you need healthcare, you should be able to get healthcare and it should not ruin your life.
An illness shouldn't ruin the rest of your life. And I think that's a really good point. Like the medical debt ballot measure in Arizona, and I have to give a lot of props to my old work, Healthcare Rising Arizona, which is part of SEIU HW, just did a great job finding stories, really looking at policies that, we won with 72% of the vote. That's unheard of on ballot measures. But it's one that people understood. You could talk about it in so many different environments where people think it's just like, what, medical debt? What? People are losing their house? Oh, that's ridiculous. And it is ridiculous. We should feel that way about it. I would also say if you're in a state where maybe you don't have the ballot measure process or your state legislature is terrible, there are some other things that I've seen. And again, another shout out to Undo Medical Debt, which is the organization that they're doing some really great policy work, but they also buy medical debt at a pennies on the dollar of it. And then they wipe out people's medical debt. We've also seen states like Arizona, Governor Katie Hobbs wiped out medical debt for a lot of the folks in Arizona, and that was amazing. But those are things too that you can work on. I've seen cities, I've seen counties wiping out medical debt in their jurisdiction. Even like it would be interesting to see if colleges, like student governments, would wipe it out too, because you really can buy a lot of medical debt for not as much money. Mm-hmm. So I think those are things too that you should look at, undo medical debt, and see what you can do at your local level, because not everywhere you're going to be able to do a ballot measure. And there's other ways you can make differences. I'm really interested in all the levels of government that you can make a difference in.
Yeah, and I know that some cities have retired medical debt.
Yeah.
And so that is, just like ballot measures are band-aiding the problem, as I said before, of a legislature that's not answering to the will of the people. Retiring medical debt is band-aiding the larger problem 100%. Of medical debt, but it's still worth doing, because every person you help is a person that's helped, even if it doesn't solve the problem. Still, it is helpful for the people that you can help.
It's a yes and. Let's fix this for some people. And it's also, my overall political and life philosophy is best and possible. I always try to work on the best and possible thing. And in some towns, some communities, that might be the best and possible. That might not be that you can run legislation, or you're not a ballot measure state, or ballot measures cost a lot of money to qualify these days. Mm-hmm. Right. And so looking at things like that, I think, are also important.
Right. Because there is a ballot measure process in many states like Florida, where the people of Florida would support expanding Medicaid so that more Floridians, hundreds of thousands of Floridians, can get health insurance. Working class Floridians that are priced out of health insurance right now because they haven't expanded Medicaid. This would pass, but the legislature refuses to act. And the ballot measure process in a state like Florida, which is very large, has expensive media markets, the ballot measure process also would cost millions and millions of dollars. So it's really unfortunate for the people of Florida that their elected officials aren't listening, and the process to go around the elected officials is so expensive.
Yeah, it's hard, but I think that's why it's really important to have a coalition, even just start talking. It's always amazing to me of how, when you start talking to folks about your experience, how that can really change hearts and minds. So I think having that coalition, and I think, states, it is expensive, but it's not undoable too. And, when those call you to ask you to collect signatures, do it. It's really, you're really making sure those issues are being brought forth. And that's super important. It's super important that, and also it's important for legislators to know citizens are mad and that we're seeing things like, and that we're paying attention to what they are or more likely not doing. And I think that's an interesting part of the ballot measure process too.
Mm-hmm. And I think a lot of times the elected officials answer to donors and lobbyists and special interest groups that are donors, and they're not to where the people are at. Because as I was saying before, people support having healthcare, and on even contentious issues like abortion, where the people are at versus where the elected officials are at. You know, you personally may not support abortion, but you support that a woman and her doctor can make the best decision, and that it should not be politicians making that decision for you. And that's why ballot initiatives in places like Kansas passed to protect people's rights.
Yeah. And you also never have to tell a ballot measure, don't say that. What's the story with that weird cousin? Like, you never have to ask that question of ballot measures, unlike candidates.
Yeah. And so I think that's when people have the ability to take action on issues that directly affect them, you can get different results than when it's filtered through a state legislature where they're answering to other people. So give people some hope, because right now it's not looking so great on a federal level in terms of access to healthcare, but ballot initiatives have been successful.
They are successful and will continue to be successful. The people, you know, ballot measures really allow you to I'm hopeful. First of all, let me just say I'm hopeful. And I'm hopeful because I am in this ballot measure space. And I really think people are connecting on these messages, and people get, like, no one thinks it's a good idea that someone loses their house because they had kidney cancer. No one thinks that's a good idea. And if you do, well, whatever. But, you know, folks can relate to that. And also, like, the coalitions that you form with the ballot measure, all of the partners, the folks that are doing the work on the ground, you can really have interesting conversations and also put together interesting policy because of that. And you're hearing things like, I didn't know about that before. And it is different than a candidate's campaign, that piece of it. And, you know, you look at how abortion did, you look at how Medicaid expansion does overall. You look at how end-of-life options is done on ballot measures. Those are the three I know. Medical debt, you know, those issues, you look at how they do. People support us on those issues. And it's really important that we start talking about all of these issues. Like, people need to hear they are not alone on this healthcare crisis, where I think sometimes when you're sick, it's lonely. I don't know if you felt that, Laura, but it's lonely. You feel like you're a bother all the time. You feel like no one really understands how terrible you feel and how hard it is to do the basic, and that you're disappointing people for not being well all the time. Mm-hmm. It's hard. And so when we talk about things like medical debt in the ballot measure space or in the legislative space, people realize they're not the only ones going through this, that it wasn't just their avocado toast or poor planning that caused this. This is designed to make you fail. And I think that's just really important for getting folks engaged. And also, I think it's important for all of our psychology too.
Yeah, I mean, I testified in front of the Nevada legislature about the end of life issue a few years ago. I think it was 2017, 2018, I testified, and the legislature, that bill did not pass. But again, these are issues that elected officials may be too afraid for a variety of reasons to go forward on. But if given the choice to the people believe that we should be making our own healthcare decisions, and politicians should not be making them for us.
100%. And Laura, that's how I met you, right? Back in 2017-ish. I was here for work, and a mutual friend connected us to talk about this end of life options.
Yeah, and it's sad that Nevadans don't get all the options that they should have, because again, the elected officials are, for a variety of reasons, not supporting those choices. But that is one of the things that the ballot initiative process is for.
Also, I'm very confident end-of-life options would pass overwhelmingly in Nevada.
Right.
We should do that.
And on that note, thank you very much for joining us for Care Talk, where we talk about healthcare and healthcare policy and answer your health insurance and healthcare questions. Please text or call in your questions at 202-838-6837, and we'll answer them in future episodes. Join us next week. I'm Laura Packard, and this is Care Talk.